Hi guys, welcome to my YouTube channel. My name is Betty, and in case you guys don't know me, I've been a nurse for about 7 years, and I've just done in the pediatric field, different positions in the pediatric field. I've worked in the pediatric unit, pediatric ICU, pediatric dialysis unit, and done some case management in the dialysis unit. So today I wanted to talk to you guys about my first job as a nurse, and that was in a pediatric unit. So if you guys want to stick around and see why I chose that position, how much I got paid as a graduate nurse, and why I left that position. So stick around. So my first job as a nurse, as a graduate nurse, was in the pediatric unit. I always wanted to do pediatrics, so I knew right off the bat as soon as I graduated that I was going to work in a pediatric unit. I didn't think it was going to be that easy for me to get a job in the pediatric unit. I always thought that you had to get message experience first, because that's what I was told by my professors. But I went ahead and just applied to pediatric unit and I got it. So I started working, I believe I was like in orientation for 6 weeks for maybe 3 months, and then I was off. But why I chose pediatrics, I've always liked being around children. I enjoy being with babies, with children, and helping them out. And then also, why a lot of people who are nurses, they're like, oh man, you're brave to do pediatrics, it's so tough. And to me, yes, it is tough, but to me the biggest reward is knowing that you're doing something to help better another being. And not that you can't do that with adults, because you can also do that with adults, but to me with adults, it's like you've already lived so many years. It's okay if you pass away, and then especially if you're in an older age, like it's okay, like that's fine. But with children, I feel different. With children, I feel like they haven't lived anything, they haven't experienced anything, and I want to help as much as I can to try to elongate that time, so they can try to get them rid of their diseases, try to help them cope with it, so that they can move on and live and experience the life that we've experienced. I mean, in a different way, right? So that was one of the main reasons. And I love children, and I enjoy being with children, and I love being a pediatric nurse, even though I'm not straight pediatric nurse, but a pediatric ICU nurse. ICU nurse, I love it. It's just so rewarding. It is stressful though, but I think any nurse position is going to be stressful. So I started working as a pediatric nurse, I believe within, it was such a busy unit, within within 6 months, because I remember being charge nurse in May and I started in January. I was asked to be charge nurse, and I was like, I just got off of orientation. Oh, what do you mean you want me to be a charge nurse? Like, I always thought it was so much responsibility to be a charge nurse, and I was like, no, like I don't. And I didn't want to be talking directly to doctors, because in the unit that I work with, only the charge nurse would talk directly to the doctor, to the physician on call, or the hospitalist. And I was like, no, I don't want to, because I was so shy, and I'm still shy, but not as shy as then. And they were like, come on, you can do it. So then I was like, okay, fine. So I gave in, and I worked the night shift also. Only orientation was day shift, and I worked the night shift. And then I was a charge nurse. Like within 6 months I was a charge nurse, and I think it was mainly because lack of nurses, and it was so busy. And then I would get like 4 to 6 patients. And when you were a charge nurse, you would still get patients. You would get maybe 2 to 3 patients, and you would get admissions. And as a charge nurse, I would have to go in and pretty much start everybody's IVs. I enjoy doing IVs, and I would do IVs, get the patients prep, and then send them off to their nurses so they can do all the admission processing. And then I would call the doctor and notify them to see any new orders that we needed to do, and then assign the next admission to the next nurse, and so on, and it will go on throughout the night. I don't know if you guys want to know what a pediatric nurse does. Like, that's, you pretty much do the same thing as any other nurse, I believe so. The only difference is that you're doing things more cautiously. In the pediatric field, everything's always more strict. There's so many, everything is strict. Medication wise, they're by kilo, everything's on per kilo, the dosing per kilo. You have to convert micrograms. Well, this is for the pediatric ICU. You have to do micrograms, and more for sedation medications you have to convert those things. But in pediatric, it's just regular milligram dosing per kilograms. Pain meds, antibiotics. It was very routine, and that's why I kind of started to feel like I needed something more challenging, because I was there for an entire year, and getting towards my year there, I was starting to feel like I was getting the same thing all the time. And just a reminder, like, I was working at a hospital that is not a trauma hospital, so you would get very routine patients. There were respiratory patients like RSV, bronchiolitis, diarrhea, fever. I think the only thing that I got at the time was Kawasaki disease, that it was a little bit different, and then having to give IVIG treatments. But it was just a lot of suctioning, which I love it, and I love doing suctioning on patients. And you there in that unit, it was only the nurse who would do everything. We didn't have no CNA, no tech, no nothing. The only people that worked there were the nurses and the respiratory therapist, and that is it. You didn't have any help whatsoever. So we were the ones to do everything: vital signs, intake and outputs, making sure that the parents had everything, all the supplies. And then, since we usually, all units always have one respiratory therapist, I would just go ahead and suction my patient. I couldn't give the treatment because usually they're very busy, but I would suction my patients. And sometimes there were nurses that don't do that. And guys, if you're a nurse, like, you have to remember that you're the one who is responsible of your patient. And the first thing that they teach you in nursing is airway. If you have a patient who is very congested and can't breathe very easily, especially a baby who has more difficulty breathing, like, you need to suction that patient. Don't wait for the RT to come, or don't wait to call the RT to come and suction your patient, because that RT probably has 10 more patients and you only have 4 or 6, but that RT is always going to have way more patients than you. And, like, just suction the patient. And so yeah, so it was getting very routine, to where it was just same patients. You would come, the patients would get admitted and they would be like, when can I go home? And I would just look at them like, you just got here. Once you get admitted, you don't go home. Like, you need to be here at least 3 days and then you'll go home. Or 24 hours if there were observations like seizures or fevers. And the parents, I think everything was just starting to bug me. And then certain nurses started to complain that, like, the day that I decided to put in my resignation letter, I actually got called into the director's office to be told that I wasn't helping with the certain nurses, that I wasn't helping them when I was being charged, that I wasn't doing anything. And I was like, what? Even the manager who was working, she told me ahead of time, she's like, I know it's not true because I've worked with you, but these are the complaints. And I was like, what? Like, I know who are these people. And this is what I don't understand, why people have to be either, I don't like the word jealous, but either jealous, envious, or I mean, like they just wouldn't be the only ones, I guess. And like, why? I don't understand why. Whenever I was charge nurse, I always did my best to help. And maybe they forgot that like I also had patients, and I had to put my patients aside to take the admissions, to do all the IVs, to start the IV fluids, and then get them off to their nurses. But there was some nurses who didn't like for me to be charged because they were the ones who liked being charged. And it happens to be that whenever these nurses were in charge, they didn't get that many patients. They would always pile it up on the other nurses, and I wouldn't complain. And I felt like they didn't like to be just a regular staff nurse. They wanted to be charge nurse. I don't know if it was to get that title as a charge nurse. So when I came along and I took over, and they're like, okay, you're gonna be charge nurse, and they started putting me more as a charge nurse, I noticed that they kind of didn't like that. And I wouldn't sign up to be a charge nurse. Like, I think the manager was responsible of it, or in charge of it. And they, like, I don't know why they complained they said that. And even another nurse I had spoken with, and she's like, I can totally vouch for you. Like, Betty, if it wasn't for you, like, I don't know what I would be doing. And it was a graduate nurse who was like, I'm so like thankful for you because you helped me with everything. She wouldn't feel comfortable doing IVs, so I would always do all her IVs. And I didn't have a problem with it because I enjoy doing IVs, not because I'm making the baby cry, but it's something that I've got very good at. And I rather just do it myself than have somebody else poke home 2 or 3 times and making parents more upset. And now I actually don't know how I'm gonna be doing with IVs because it's been a long time since I've done an IV. And then the unit was getting very stressful. There was so much stuff going on that people were starting to be different, and I noticed that I started to change too. My personality was changing. I was getting irritated very easily. I was just starting not to enjoy my job as a nurse, where I was at the point where I was thinking like, maybe this isn't for me. This isn't what I was thinking. Maybe pediatric isn't for me. I don't know unless I do something else. So then I decided to put in my 2-week notice, and I had spoken to a agency nurse who was working in our unit, and he gave me the greatest advice ever, like to move on, and that I was doing a great job by moving on to another job. It's like, there's a lot of people who are here, have been here forever, and they will stay here forever. They will not grow. You need to grow. Like, if you want to grow as a nurse, and if you want to grow your money, also get better pay, you need to get out and move around and explore and get more experience. So he was very nice. He was an older person too. He was so nice. And yeah, and I was just like, okay. It was just like an affirmation, hearing it from him, telling me, from a wise nurse telling me like, you are doing the right thing. And then I didn't even have a job, like another job lined up for me. I was like, okay, I think I'm ready to just quit. And actually I guess I was so stressed out, and maybe I was just disappointed that I wanted to do pediatric nursing so bad that after experiencing all of this throughout the whole year, I was like not content, to where I was like, I had told my mom like, I'm gonna take a break. And I was even thinking of becoming like a substitute teacher for the meantime, just to get my mind off of nursing and see if what was going to be my next step. And so then I quit. And I know I mentioned that I was going to say how much I got paid as a graduate nurse. So that job was my first job. I got paid, my base pay was $21. I think it was $21, if not $22, but I think it was 21. 80 ins were getting paid just $1 less. I have my BSN, so they told me like, oh, just submit your graduate certification. diploma, and we'll give you a dollar raise. But yeah, so that's how much I got paid as a new nurse. And obviously if you work night shifts, you get differentials. I don't remember what the differentials was, and I don't remember what was my exit pay, like how much I was getting paid by the time I got out. But yeah, so then I decided to take a break and get out. I think I lost track. I was going to talk about pediatric nursing, why I chose it, why I quit, how much I got paid. And I actually ended up getting a job, I think within 2 weeks. The last day that it was going to be my working day, or the last week that it was going to be my working week, I ended up applying at a hospital nearby at their pediatric unit, thinking that I just needed a change of scene. And I'm like, you know what, let me just try this. If it goes through, it goes through. If it doesn't, then it doesn't. It means maybe I need more time off. And I called the director because I hadn't gotten a call, and then they called me to let me know that their position for pediatric was full, but if I was interested to take in the pediatric ICU position. And I was like, no. And they're like, yeah, like you can still do this. I'm like thinking in the back of my head, like, no way, like I can't do this. Like, this is pediatric ICU. Like, I feel like in order to be in an intensive care unit, you need to know a lot more. And I felt like I didn't know much because I only knew like the basics and the most common things that you get in the pediatric unit, but I feel like I didn't know anything critical wise. And the wise nurse that I was talking about, he was like, do it. This is a opportunity for you to grow and learn. If it's not for you, then you can always leave it, but try it before you say no. And I was like, you know what? Yes. I always wanted to do NICU, and I'm like, maybe this is a route for me to get to NICU. And so then I took it. I ended up my last working day in my pediatric unit, I got the call to let me know that to start working within 2 weeks. And I started within 2 weeks in the pediatric unit. And then I stayed there for like what, five years, I think, or four or 5 years. And yeah, and that's how I became a pediatric ICU nurse. And one advice that I can tell you guys, if you're a nursing student or nursing, or thinking about like quitting your job or quitting nursing in general, ask yourself why you're quitting. Are you quitting because you're not happy with yourself? Are you quitting because people are not making you happy? Because the unit that you're working in currently is not satisfying your needs in any way that you wanted it to be, what you imagine? Give yourself a chance. I always tell this to people who I come across and they're like, I don't like nursing, I think I'm gonna quit. I always tell them, like, try a different unit. Maybe it's just a unit. Maybe you're not good in med-surg. Not necessarily being as a good nurse or bad nurse, but you're just not feeling it there. Why don't you try labor and delivery? Why don't you try maternity areas? Why don't you try pediatric units? Why don't you try a different adult unit? Neurology, anything, cardiology, if you want more criticalness, like ICU, cardiology, ER, like go to a trauma hospital. Like, there's so many things. And even if you don't like you're like, I'm over bedside nursing, I don't want to do this, there's so many positions out there that you can do that they don't require for you to be a bedside nurse. There's case management, there's home health, there's IT, computer, informatics. That's what I meant by IT, computers, informatics. There's so many, school nursing, so many. You can do cruise nursing. Like, there's, in any facility that you can think of, there's probably a position for a nurse. So yeah, and I just want to encourage any nurse out there, new nurse, like give yourself a chance. You need to experience the field that you're going into. I would say 6 months to a year to really know if it's for you or not. And there's nothing wrong with you quitting that job, and there's nothing wrong with you switching like all the time to different fields to find out what it is that you really like. It's all about you. So, and don't forget that you're a nurse, so you're giving and helping others. So if you want to give and help out others, you gotta treat yourself too and be content with yourself. Because once we get too stressed out or we're unhappy with whatever is going on with our lives, we will portray it in our work field. Even if it comes out a little bit, that a little bit can be big to the patient, to the parents, to your colleagues. So always treat yourself and take care of yourself so you can take care of others. So yeah, so I hope I answered everything you guys were thinking of regarding pediatric nursing. I personally love the pediatric fields. I would like to get back to pediatric ICU, if not to try pediatric ER or any pediatric OR related fields. So if you guys have been in that position, any tips I will take. And yeah, so if you guys want to keep watching more videos regarding nursing, my nursing experiences, don't forget to subscribe, like this video, and share it with your fellow nurses. Thanks for watching, guys. Bye.